My name is Jill Olmstead. I'm a gastroenterology nurse practitioner, and welcome to my GAP, MASLD, and MASH Community Network APP Insight. I am a gastroenterology nurse practitioner, and I work for Providence Health in Southern California. And what I'd like to go over with you is APP Insight's misconceptions on liver health. And I think one of the first misconceptions that I hear from my patients is that everyone has fatty liver. What's the big deal about it? And it's so key for us to be able to educate our patients that fatty liver disease, or with a new naming terminology, it's changed from NAFLD to MAFLD or MASH. It's so important that we spend the time to give them the education that this is a metabolic disorder, that the fat that's in their liver that's causing the elevated liver enzymes is causing damage in their liver, and that there are other factors that could be causing that or triggering that, which is going to be obesity, but also potentially if they're pre-diabetic or diabetic, or they have elevated lipids or high cholesterol. I will take the time to share that with my patient and go over their labs with them. They may have had a hemoglobin A1C 6 months prior, and if it was 7.0 and their lipid panel was, the total cholesterol was 290, and their primary care doctor is giving them a chance to go ahead and exercise, lose some weight, and take the time to say, now is the time for you to make some lifestyle changes because this can damage your liver. The fat in the liver can cause liver hepatocellular injury, and fat in the liver can transition from fibrosis to cirrhosis. So it's so important that we reduce that misconception for our patients. The second misconception that I find in my patients is that they feel that alcohol is safe to drink. Well, I only drink a little bit. I only drink 2 glasses of wine a night. And I explained to them that alcohol is a toxin, and alcohol is being metabolized through our liver because our liver is the clearinghouse from our body, and that there's no amount of alcohol that is safe for our livers. So I encourage patients to drink as little as possible and really reinforce that misconception that alcohol is safe for them to drink. I think we're still under that guise of red wine is cardioprotective. And I explain to patients that it's important that you look at how the alcohol is metabolized through your liver and that it is considered a liver toxin. So a small amount as someone can consume on an intermittent basis is going to be the healthiest for them. So I think this is an important APP insight to share with my patients as well as my colleagues who I'm sure they have similar experience. So feel free to go to my MASH Community Network site to listen to this podcast or any other of my colleagues. We're trying to provide outreach and awareness for the importance of MASLD and trying to educate our patients to improve their liver health. Thank you.